Before we begin, let me just say thank you and for being here, for coming and taking your time to not only hear the presentations but really discuss and get involved in what I think is a really important topic. We have the honor, and I'm deeply grateful that Admiral Brent Giroir, the Assistant Secretary of Health at the U.S. Department of Health and Human Services, is here with us this morning. And he's the Secretary's principal public health and science advisor. He oversees the department's broad range of public health offices, including HIV policy, women's health, disease prevention, and he also oversees the Office of the Surgeon General and the U.S. Public Health Service Commission course. Dr. Giroir is both a physician and scientist. He has served in many leadership positions. He chaired the Veterans Choice Act Blue Ribbon Panel to reform the U.S. Veterans Health System during the Ebola emergency. He directed the Texas Task Force on Infectious Disease Preparedness Response. He was Executive Vice President and CEO of Texas A&M Health Sciences, a professor of medicine and engineering. He's a member of the American Board of Pediatrics, as well as the first physician to direct DARPA's Defense Department office. He's trained as a pediatric critical care physician and has cared for critically ill children for 14 years, and he was the first chief medical officer of children's health care in Dallas. He has published over 100 peer-reviewed publications. He holds patents in a number of biomedical interventions. He's the recipient of numerous honors and awards, including the U.S. Secretary of Defense Medal for Outstanding Public Health Service and the American Heart Association's President Lyndon Baines Johnson Research Award. So we're really grateful that he's with us this morning, and I would invite him to please say some words.
Good morning. It's an honor to be here with you today on what is now my fourth week in this position as Assistant Secretary for Health in the Department of Health and Human Services. I want to thank everyone at the National Academies for hosting this meeting and who's worked on an accelerated timeline. We all know that the timeline was accelerated because we are in the midst of what will be looked at as amongst the most pressing and important public health crises of our time. That is the opioid epidemic and all of its sequelae. In particular, I want to thank Dr. Del Rio for leading the planning committee and for all the committee members for their hard work. Dr. Del Rio this is the first time we've met, but when I'm calling around to my network, he came up on just about everyone's list as a person I needed to meet and should try as much as I can to get him involved with our office. I want to extend my gratitude to all the speakers and attendees who are both here in D.C. and who are on the video teleconference that we're having right now. And I really am here for a couple of reasons. The first reason is I'm here to learn. What you are going to say is important to our knowledge base. But the second reason I'm here is to assure you that I am listening and I am concerned about this topic, and that we in the department, certainly in my office, are listening and concerned about the topic. I've been on the other side of this podium in my previous life many times, and the one thing I always wondered was, I'm giving up 2 days of my time and a lot of my effort and passion, and will it matter? And I'm primarily here to assure you that what you're going to do over the next couple of days will matter. We will listen, and we will do as best as we can to turn it into actionable items to make a dent in what's a growing problem throughout the country. Thanks to our two offices who are co-sponsoring this workshop, the Office of HIV/AIDS and Infectious Disease Policy and the Office on Women's Health. I see Rich there. Is Nicole in the audience somewhere? I don't know if Nicole's going to be here. I think she may not be here this morning. So let me start by reviewing some of the sobering statistics that I'm sure all of you know, but at least it could set the foundation for this workshop. Opioids continue to have a devastating effect on the lives of Americans. According to the CDC, each day we lose 115 Americans to an opioid overdose. That's one death every 12 and a half minutes. Drug overdoses have increased 300% between 1999 and 2016. With that, injection drug use has increased by 93% between 2004 and 2014. Opioid-related hospital admissions have increased by 58% over the last decade. Why we are here, and we all know this, is that we are also witnessing the inexorable sequelae of the opioid epidemic. One of the major ones is the increasing spread of infectious diseases. I'm a pediatric critical care physician, but all my work has been in infectious diseases, so this is really a topic that is near and dear to me and one that I know we can make an impact on. According to the CDC, hepatitis C infections have tripled between 2010 and 2015, and this includes an increase in pregnant women with hepatitis C, enhancing the risk of perinatal transmission. Hepatitis B infections, which had been decreasing in recent decades, are now up 20% between 2014 and 2015. And HIV infections among people who inject drugs have increased by 4% between 2014 and 2015. Hospitalizations for serious infections associated with the opioid crisis have also quadrupled in the last decade, and one analysis using data from the Agency for Healthcare Research and Quality estimates that just these hospitalizations have added nearly $15 billion in cost to the healthcare system. The increase in injection drug use appears to be the main driver for these infections, but some are also spread through sexual contact and other modes of transmission, including perinatal transmission and person-to-person contact. So now that we can quantify the infectious disease consequence of the opioid epidemic, we must envision and implement an aggressive new agenda for responding to these infectious challenges, and that's really why we're here today. And the way I look at it, certainly as a pediatrician and a public health expert, we need to solve the acute problem, but we need to get ahead of the curve. We need to be proactive and not just reactive to crises that we might be able to predict. So in addition to looking for solutions to what we have today, let's be proactive and figure out how we can avoid these situations in the future. I think it's important to understand that the department overall, as emphasized by Secretary Azar, is committed to solving the overall opioid crisis. And there's a 5-point plan, which hopefully all of you have heard by this time. The first is better treatment, prevention, and recovery services, and you will hear this over and over again throughout the department. Second is better targeting and dissemination of overdose reversing drugs. Third, better data on the epidemic. Fourth, better research on pain and addiction. And number 5, better pain management. Our office is involved very heavily in a couple of these, particularly understanding how to manage pain better and promoting the research that's involved, that's necessary to improve treatment as well as offer new medications to alleviate the pain. Our Office of HIV/AIDS and Infectious Disease Policy leads the implementation and monitoring of the National HIV/AIDS Strategy and the National Viral Hepatitis Action Plan. Both of these national plans provide a framework designed to facilitate collaborations across sectors, improve outcomes among priority populations, and put the U.S. on the path towards eliminating HIV, hepatitis B, and hepatitis C. And Rich Wolitsky, the director of that office, with whom I had probably one of my top 2 meetings going around. We just seem to enhance each other's passion and ideas for this area. He'll be speaking about this more this morning. One of the ways our office is committed to improving health is through enhanced partnerships, and you probably have heard this by the Surgeon General, whose motto is better health through better partnerships. And we intend to do that, to strengthen old partnerships, to create new partnerships, and new collaborations with, I would say, non-traditional partners. I think we have always partnered with the academic community. I think we could do better by partnering with the nonprofit community, the business community, and the appropriate partnership with law enforcement communities. As I said, I'm very proud to be working alongside my colleague, Surgeon General Jerome Adams, and the nearly 6,500 men and women in the U.S. Public Health Service, and that's really why I'm wearing this uniform. The Corps' mission is to protect, promote, and advance the health and safety of our nation. Many of these dedicated service members are stationed in communities of extreme need, working to respond to the opioid epidemic and the infectious disease crises in some of the most underserved areas of our country. including with the Indian Health Service and the Bureau of Prisons. Other commissioned officers are working in key agencies such as the FDA and CDC, where they implement and manage critical programs to support our response to the epidemics. I believe the Corps, as we begin to transform it for the next century, will have an ever-increasing role in our national fight against opioids, infectious disease, and persistent health inequalities. And I would just ask you, when you're deliberating about actions forward, think of how the Corps can help. This is 6,500 professionals in uniform, ready to go, whose only mission is to be on the front lines for public health. Think about how they might be used in different ways, in novel ways, on the front line of this epidemic or others in the future. I'm also pleased that this workshop will explore how we can improve our efforts to address the opioid epidemic comprehensively by engaging the full range of sectors being affected. We must work to better integrate our efforts into existing programs, but also we're willing to build new programs. Your advice is very important in this effort. Can we build on structures already there? Do we need to think entirely out of the box? I am encouraged because I know, particularly on the infectious disease side as well as the opiate side, we can make a difference, and we can make a difference soon with many of the tools we have now. Although it's intuitive to us, the CDC does provide us statistics that as many as 75% of the new HIV and hepatitis C infections can be prevented by providing a variety of comprehensive services, including counseling, education, testing for HIV and viral hepatitis, vaccination for hepatitis A and B, access to sterile syringes, and referral to substance use disorder treatment. These are all within our current toolbox, and they should be effective. We also know that treatment of HIV with the appropriate regimens adhered to correctly can lead to very effective viral suppression, which almost eliminates the chance of transmission. And new treatments for hepatitis C are highly effective and, as we know, can result in complete virological cure of the disease, something that when I was in medical school was almost unimaginable, that we could actually take some pills and be cured of hepatitis C. Along with the elimination of Haemophilus influenza B, which was half my children's hospital. I think these are amongst the two most important medical miracles of our time and should rank there for everybody's book. Fighting the opioid epidemic is a priority of Health and Human Services, and I think this event illustrates this. The Secretary's speeches every day will illustrate this as well. So, in conclusion, I want to thank you again. This meeting and the resultant summary will inform our strategic priorities and programs. I hope it will spur enhanced investment into existing programs as well as potentially investment into new programs. I look forward to working with all of you. I was happy just to meet a few of you before the meeting, and please know that my office is always open. Thank you very much.